Good afternoon, everybody, and thank you for joining us for the latest edition of Valley Children's Virtual Health Series for Families. I'm Zara Arboleta, and today we are doing a virtual health series segment in collaboration with Fresno County Behavioral Health, as well as Fresno Cares, local suicide prevention, a local suicide prevention agency and awareness group. We're joined today by several people who are taking time out to join us on the very important topic of mental health during COVID-19, wildfires, everything going on right now, and how important it is to bring awareness to suicide prevention and mental health awareness as well. We're joined by Brandy Lidbeck, who is chair of the Fresno Suicide Prevention Collaborative. Brandy, thank you for joining us today. Along with David Lopez, director of the Central Valley Suicide Prevention Hotline, and Dr. Carmela Sosa, Valley Children's Medical Director of Primary Care and the Guild Center for Community Health. So before we get started, I wanted to give the audience a chance to meet all of you. And as a reminder, for those of you watching on Facebook, you can leave questions and comments in the Facebook Live comment section, and we'll get those questions over to our panel of experts today. So let's start first off with Brandy Lidbeck. Brandy, if you don't mind introducing yourself to our audience.
Sure. My name is Brandy Lidbeck. I'm the chair of the Fresno County Suicide Prevention Collaborative. I'm also a licensed marriage and family therapist and a two-time survivor of suicide loss myself. I lost my mom when I was a child, and I also lost my cousin after he came home from Iraq as he was deployed in our military. And I've spent the last 5 years or so working with fellow suicide loss survivors through support groups, therapy, and then also running the Fresno County Loss Team.
Thank you so much for not only lending us your expertise as a therapist, but also sharing your personal stories as well. We appreciate your time.
Of course, thanks for having me.
Right, and David, you're up next.
Hi, yes, thank you. Yeah, my name is David Lopez. As I mentioned, I've been running the Suicide Prevention Lifeline for Kingsview for the past 5 years. Prior to that, I was a field clinician working with law enforcement in the field, actually assessing them. And I've also worked at the Crisis Stabilization Unit here in Fresno. And that's an inpatient unit where we stabilize individuals. Like Brandy, same routine. Been a therapist, and I'm really passionate about it. Like her, I'm also a survivor. I've had several friends who have died by suicide. Several within the past few years. And it's something that just continues to be a topic where I'm very passionate about, and I feel that as a community, we can really make a difference in saving lives.
Thank you as well for sharing your expertise as well as your own personal stories about this, David. And then Dr. Sosa, for many of our families, they're already familiar with you, but for those tuning in for the first time, please introduce yourself.
Sure, I'm Carmela Sosa. I'm a general pediatrician here at Valley Children's, in addition to my other roles in medical directorships. But really, I'm a native of Fresno. This valley raised me. My children are raised here. It's really important that all of our kids have the best opportunity to really succeed and to thrive. And unfortunately, as a general pediatrician in my practice, I see a lot of depression, anxiety, a lot of my patients with suicidal ideation and attempts, and unfortunately completions. And so it's just really critical that we are out there on the front lines, as David and Brandy both said, just helping to intervene and save lives and keep families intact.
Thank you, Dr. Sosa. The one thing that we have been talking about since we first started planning this with Fresno County weeks ago is that so many people, it's 2020, yet so many people are still so embarrassed and ashamed to even talk about mental health. And I know something that the three of you really wanted to address today was the stigma of it. And so I don't know if Brandy or David, you want to start just talking about why you think there is still just this cloud over even talking about mental health and asking for help.
Right. So I hope you all can hear me. One of the biggest things is stigma is one of the biggest barriers, or our thoughts around. It's called like prejudice. Let's call it what it is, right? It's prejudice. It's something that people think about and people are afraid of from getting help, right? Stigma is the biggest barrier around, and it's in a lot of different communities. People are just afraid to come out and talk about their feelings for either viewed as being weak, as not being normal, as seen as the term I'm crazy, and just not being put together. And one of the biggest things is that it's a mask that people walk around every day, hiding the social pain. It's one of the biggest barriers that we have to people receiving help. People usually, that the onset of a mental illness starts with, because of stigma, can start, usually people won't get help until 5 to 6 years since that initial onset. Unfortunately, that's seen a lot more with children, but that's also seen with adults. It's one of the primary barriers of treatment, and it's even more enculturated in various cultures throughout, like just like the Valley has so many different cultures. People just don't want to come out and be viewed as that. No one wants to be labeled as that one. And one of the things I usually say about that is, if you had diabetes and you went to the doctor and the doctor said, oh, okay, you have diabetes, we're going to give you some medication and here's your prescribed treatment, right? There's not really a stigma associated with that. But yet, and you look at the diabetes as an illness, well, when people seem to say, like, oh, you're depressed, they tend to internalize that and say, oh, I'm depressed. Or it has a different life, and it's a big barrier. So instead of, I'm depressed, no, I'm currently suffering with depression, and there's help and ways for me to remediate that. So that's one of the biggest keys is if we can all just take a time out and look at mental illness as just an illness, it's something that is part of our lives as humans, then we can all move forward together better.
Randy, are you seeing the same thing in your work? This stigma to even ask for help or even broach the topic?
Yeah, I see it on the other side a lot with people who have lost people to suicide. They don't want to tell people it was a suicide because there's so much shame attached to it. So they'll say, oh, it was an accident, or it was whatever it is, because they don't want to use the word suicide because there's so much shame attached to it. So they'd rather people not know. And then it kind of just solidifies the stigma. Like, it's such a shameful thing. We're not even going to talk about it. We're not going to talk about how they died. And so there are a lot of times where over the years, I've had kids come to me saying, my parents told me forever that it was a car accident. And then I came across the death certificate and I saw there was actually a suicide. So now I've been lied to for the last 10 years or 15 years because my family was so ashamed to talk about a suicide.
And Dr. Sosa, for you, when you see children coming in for their primary care visits, are you seeing it from the other side too, in the clinical setting, of parents who don't want to ask you for help, don't want to talk about it? What are you seeing in clinic?
Definitely, I see some of that. I see oftentimes parents will sort of, they'll attribute the anxiety or the feelings of sadness to just being a teenager. Oh, you'll get over it. Sometimes those feelings that their teenager has are, I don't want to say belittled, but they're not problems like we as adults have, facing, financial difficulties, etc. And so they're not taken as important. But we have to understand that teenagers, adolescents, that social world around them is what really keeps them afloat. That's what drives them. And so we have to really pay attention to that. And really adding on to what David had mentioned about the naming of, I have depression. You don't say I, or say I am, we say I am depressed, but we don't say I am cancer, right? We don't say I am asthma. It is just something that I'm dealing with. And so I think shifting that label, as David was mentioning, will help to shift that stigma as well. Some of this historically comes from medicine too. Many years ago, we used to think from the medical standpoint that hysteria came from the uterus, and therefore you would have a hysterectomy to cure your hysteria. So we've really just got to make some big shifts in seeing this as just a process, an illness that we are dealing with, but it definitely does not define who we are.
So we have had lots of questions coming in, but before we get to that, one of the main reasons that we are doing this particular virtual health series is because last month there was an alarming spike in the number of teenagers who were attempting suicide And unfortunately, there were some deaths too. And it was to the point where Fresno County issued an alert. School districts were sending, I got it, I'm a Clovis Unified parent. I got a letter from the district saying, hey parents, we have a serious issue to deal with right now. We really need to start. I mean, it was always important to talk about it, but we really need to talk about this now. Everything is kind of at a head right now. We are in month 7-ish of the pandemic. We had the wildfires that sparked over Labor Day weekend. School's still not in session. Businesses slowly starting to reopen. I know, David, that before we got to the questions, that you had some statistics in general to share too, just about how prevalent mental health issues are in our area and in society in general.
Yeah, absolutely. So in 2018, the CDC, with the Centers of Disease Control, actually identified suicide as an epidemic. It is the 10th leading cause of death in the United States. In 2018, we lost about 48,000 individuals to death by suicide. And we actually know that that number's a lot higher. And that's because a lot of different states don't report up directly to CDC. In each state, there's different bodies that actually report out. And there's a different things like unequivocal deaths or undetermined deaths that could be by suicide. So we know the number is probably 5 to 10 times greater than that of death by suicide. Additionally, deaths by suicide is the second leading cause of death for 15 to 24-year-olds in America, second only to accidental deaths. So it is extremely prevalent, and it's something that we definitely need to keep an eye on and work together collectively to improve.
Thank you for sharing that. We did start soliciting questions last week, and many of the questions, we saw certain themes emerging. And one of the biggest questions we got, one of the most frequent questions was, what are some things to consider contributing to individual stress and anxiety right now? And how do we see this manifest in people? So we kind of got so many variations of what's impacting mental health right now and what are signs that we can spot for this. So I don't know if, I think, David, do you want to start this one, or Brandy?
Yeah, sure. I'll start it off and we can all collectively join in on this one. So with that, it's definitely a compound effect of what's happening in today's society. First and foremost, we have a fear or anxiety surrounding COVID-19. There's a stress around that. It's had significant financial impact. People are getting sick from this disease. People are dying from that. Additionally, people have been laid off from jobs. Kids have not been able to go to school. Businesses have shut down social activities, things that we were able to escape and do our normal activities have been impacted. And the socialization piece, especially for children, has been removed, which is such a key point in their developmental stage. And it's something that we're losing out on. So it's affecting everyone, and a compound effect is starting to occur. One of the biggest things is looking at this is viewing COVID-19 as a pandemic, the pandemic as a natural disaster. And you can, if you view it as a fear of natural disasters, such as a wildfire, which we also are suffering right now, it goes through stages and waves. And one of the biggest things that we want to do, or with this message, is we know that post-natural disaster or event like that, there's an increase in post-traumatic stress disorder, and there's an elevated risk for suicide when that event ends, which lasts up to 24 months. Right now, we're still amidst this event, and so there's not even a telling. And on a ACEs score, which is an adverse childhood experience, these are consistent traumas that our children are going through. And so all these things are compounding and are going to lead to these effects that we may not see years from even now. That's just kind of the start of the compound. I'll let everyone know.
Yeah, Brandy, how about the question, what are signs? Because some people seem to think that depression manifests itself just by somebody being sad.
Right.
That's only one of many different signs of depression.
Yeah, we kind of think of people who are depressed kind of as looking like Eeyore from Winnie the Pooh, right? He's just kind of like slow and depressed, and when he speaks, it's slow, and he moves, it's slow, but that's not always the sign. So things to be like mindful of and to look for are obviously direct statements like, I'm going to kill myself, I wish I were dead, I'm going to end it all, but also indirect ones like, I feel like I'm a burden to others, pretty soon you won't have to worry about me, who cares if I'm dead anyway. Those are kind of more indirect ones. And then we have behavioral clues. So the more you see of these, the more a person would be at risk. So that could be any previous suicide attempts, obviously puts them at a higher risk. Co-occurring depression, moodiness, hopelessness, acquiring a gun or stockpiling pills, giving away their prized possessions. We see that one a lot. That happens quite a bit. Drug or alcohol abuse, especially after a relapse. Unexplained anger, aggression, irritability. So people don't recognize it, but anger is oftentimes a huge sign of depression, right? And you're just like, geez, they're just angry and they snap at me all the time. But that's actually what, manifests out of depression. And then situational clues, kind of a lot of what David's talking about. These things put a person more at risk. And so that's can be being fired or expelled from school or from a job, a recent unwanted move, loss of a major relationship. Especially with teens, we see breakups are a big deal because in their scheme of life, we look at it and say, oh, it's just a teen breakup. You're going to be fine. You're not going to marry that person anyway. But to them, that's a big deal. And so going back to David's answer earlier of school not being in session, there's a lot of hopelessness because it feels like we're never going to get back to school. We're never going to be able to go outside and play because of the fires. We're like all these absolutes words. And then so there's, anticipated loss of financial security, just a lot of loss. And so kind of being aware of some of those signs and then acting on it. So when you see someone that you are kind of manifesting these signs, to ask them the questions, talk about it.
And so thanks for that. Dr. Sosa, what are you seeing when patients are coming into Valley Children's? Because it's sometimes well, not always, but sometimes it is easier to spot these signs in adults, maybe not, but and even teenagers. But when you're talking about 5-year-olds, 8-year-olds, 12-year-olds, what are some things that you tell parents to watch out for when it comes to their kids?
Right. I've actually been seeing a lot more parents coming in with their children, and the parents have been expressing a significant concern over just persistent aggressive behavior, perhaps towards siblings, just being angry all the time, acting out, various behavioral issues that they didn't have before. So I have a lot of parents who are coming forth with this, but some of the other things that you'll see in kids and in adults would be, a lack of interest in things that they used to really love to do. So maybe they loved doing certain arts and crafts or painting, and now, no, don't really want to. They may sleep very little, or they may sleep excessively. And I know sometimes with a teenager that may be a little hard to differentiate. Certainly changes in appetite, overeating, undereating, just skipping a lot of meals. Some things that we see a little bit more specifically too toward adolescents have to do with increased social media use. That can sometimes be a sign of depression. Being really focused on death and dying, maybe not specifically saying, I wish I were dead or I'd be better off dead, but just perseverating on death and or dying, watching movies, watching videos, thinking about it, drawing about it. And a lot of self-criticism or self-deprecating behavior. I'm so stupid, nobody likes me, I'm never gonna amount to anything. So just those signs additionally you can see in adolescence.
So we've talked about the signs. Now we've been getting a lot of questions about, okay, then what? Then what do you do? So Brandy, there are parents out there who when we were talking about this last week, who don't even want to talk about it with their kids because they're so afraid, like if they talk about it, they're going to manifest something horrible.
Yeah, so parents, I get this question all the time, are so scared, and I understand it. They're so scared that if they ask their kid about suicide, that perhaps maybe their child wasn't already thinking about it, and just by mentioning it, they're going to give them the idea, right? Like, oh, I hadn't thought about suicide, but now that you give me that option, maybe that is, something to consider. And I would say that is so far from the truth. And so what we want to convey to parents is, if we go back, this is always my example that I use. If we go back to the olden days of when we introduced sex education into schools, parents and teachers were really scared that if we start talking about sex with kids, then they're going to go have sex, right? But the reality is they were already having sex. And so instead what sex education did is they taught them about safe sex and abstinence and STDs and what to do, and like if you have one, or resources, or whom to talk to, right? And so now we're doing the same thing with suicide. It's not giving them the idea. It's just saying, if you're thinking about it, let's get you the help that you need, the resources in the community, how we can talk about this openly and not be scared to talk about it. I've had parents who say, I'm not going to ask them because I'm so scared that if they say yes, what am I going to do then? And so we really need to talk about it and get them the help and the resources that they need.
So interesting that earlier you were talking about, David, some of the cultural, some of the cultural influences when it comes to talking about behavioral health. And we got a question from Facebook just now. Someone says, how do we break the stigma in a Hispanic household? I have a sister who is dealing with depression, was suicidal at some point. She's been getting care at Kingsview. We don't feel like that she's really been able to talk about it. The family really needs to come together. So what are some things to help this person communicate to the rest of the family that this is serious and everybody needs to work together to help her sister?
Yeah, that's a wonderful question. First and foremost, I'm glad that they're getting the help that they need and continue to remain steadfast in that treatment, right? We know that with treatment, you can reduce a lot of the symptoms and recover a lot from that and live a healthy life. The first part would be starting the conversation with your family, and hopefully, because if you're asking your sister, it sounded like, right, the sister was having a question. So obviously there's concern from the family, but maybe how do you break the stigma between the parents or other family members? So maybe that sister could be a what we call promotora in the community, in her family, right? So she could be the one that kind of promotes the mental health, and that it's normal, right? That we want to normalize it as best we can. Look at it as something, like we mentioned earlier, as an illness, like diabetes, and there's no shame around that. And then open up those conversations and avenues for the family to come together and support her. The biggest thing is misinformation. Again, one, not wanting to be labeled. So if they can start to have that dialogue, and even if she could promote that, hey, this is what my sister's dealing with, and I want us to rally around it, and it's viewed no different, that could at least start it. But breaking down those barriers is very important through conversations. I think that's the first and foremost way.
Thank you. We do have a couple of questions coming in. Maybe Dr. Sosa, you can speak to this one. There have been questions from people who are asking, how do I help my child who it seems like is suffering from depression, also has autism spectrum disorder?
Sure, that's a really difficult question, and I think it depends somewhat on how well your child can communicate. But depending upon the level of their communication, you want to ask developmentally appropriate, open-ended questions. Again, if they're able to communicate, you want to be non-punitive. So perhaps the child won't understand if you're non-judgmental, because you do want to be non-judgmental with your teens, with your children as well when it comes to behavioral health and mental health issues. But really being non-punitive for your child feeling or acting out, because is going back to David's comment about ACEs, or the adverse childhood experiences. And when people experience trauma, and of course we're in this time of repeated ongoing trauma right now, in addition to anything else that may already have previously been going on, it's not about saying what is wrong with you, why are you acting like that, but what is going on that's causing you to feel this way? Or what if your child cannot communicate, what might be going on that could be contributing to their outbursts or their behavior? Mm-hmm. And so for just children in general, it's really important to have as much of a schedule as possible, have as much predictability as possible. The more control that children feel that they have of their lives, the better. And in these times where it seems like everything is unpredictable, it's having a schedule, having it really try to stick to that as much as possible. That makes children feel like there's much less chaos in the world. So that would be, a couple of things. Also, we always want to talk about our primary goal of keeping kids safe, right? And ways that we can keep kids safe in terms of providing them protective factors. when it comes to thoughts of suicide would be really making sure that they are connected to caring, loving adults, that there's a sense of community, that they have goals or things that they enjoy in life. So really looking for those things as well. Hopefully that helped to answer a little bit.
Thank you. Here's one maybe for you, Brandy. Someone just asked on Facebook, there are situations in which kids talk about suicide in a joking manner with their friends and at school. What can be done to teach kids to take suicide talk seriously and steer them away from using it as a punchline of a joke?
Yeah, I get that question a lot. So I always say I would have that conversation every time somebody mentions it. So if a kid said, oh, I wish, I'm going to kill myself, or, oh, I'm going to, kind of some of those jokes that go around, I would have that conversation with them. And they're like, no, I was just kidding. And I'm like, well, I'm going to ask you every time because I care about you. I'm concerned. And so if you were going to get tired of me asking you, then maybe change the way you talk about this, because it's really not a joke. It's not a laughing matter. And so I would just say, touch on it every single time. And they'd be like, geez, stop asking. Well, then stop joking about it.
No, that's true. Kids are kids. On the one hand, they joke about the most, and adults do it too, the most off-color topics all the time. And so is there ever a situation when, Brandy, you think if they are joking about it, it actually is them asking for help?
I mean, I don't think it's out of the norm. What we know about is when after a suicide happens, right? People all sit around in a room and they talk and they're kind of comforting each other. And someone will say, he or she said this to me. I wonder if that's what they were getting to, right? Or, oh, they shot me this text and I didn't know what that meant, but now I kind of see, like, was this leading up to it? And so I do think that a lot of times we know that, hindsight is 20/20 for a reason, because we can put it all together and kind of fit the pieces together and say, I wonder if that was a hint, or if that was a call for help, or, and so I would just say, take everything seriously and ask on it, especially if something in your gut says something's not right. I would act on that because there's a reason that it's kind of going off in your gut.
There have been several different questions around this theme. How do you possibly start to manage emotions when there is so much going on that is causing stress? It's everything from not only the pandemic, but also this particularly contentious presidential election that's coming up. You have the racial inequities and the protests that were earlier this year, and you have the wildfires. So I don't know who wants to take this one, because it is a pretty big question, but even in our group, when we were doing these meetings, we're like, what else could possibly happen? There is so much happening. So how do you even begin to digest it and cope with all of these external factors? And we haven't even got to if there's something going on in the house on top of everything else. So I don't know who wants to take the question of what do you do when we seem to be constantly bombarded by a million different negative attitudes, events, opinion, all of that.
I'll start. I think all of us can chime in since it is such a big question to digest. Starting off with, one of the things I say is controlling the controllables, right? Control the controllables. What can you actually control in your day? I love what Dr. Sosa said about establishing a routine. That's one of the biggest things for children to help them feel safe and normal. For adults as well. If you've been having to sit at home or been in this, hey, what was your daily routine? And kind of keeping that up, getting up, getting yourself showered, getting dressed, doing throughout your workday. And it's important to keep a very important sleep hygiene. Like, what are you doing at night to get you to sleep? Because that's the only time that our minds rest. And it's one of the biggest things that help us process stress and let our minds relax. So those are just like two bookends. Like, that's one of the biggest things I used to say about bookends, right? Control your bookends, control your morning and control your night. And at least keep that established routine. And when I treat people with depression, one of the biggest things I look at is looking at how are they sleeping and their sleep cycle and their wake cycle. And I want to know what time they're waking up, because if we can at least get them to rise the same time, that's a controllable and they start to get their day moving. And then how are they sleeping at the end of the day? That's just to start. I'll let the rest of the group do it.
Mm-hmm.
I'll piggyback off of that with the controlling. That's one thing that I always say. What is it that is in your control right now? And it feels like not much at all, right? After all those things you named. And so what do I have control of? I have control over turning off social media, right? Or not turning on the TV, or not getting involved in those conversations with people who are just in for an argument. Or, you know what I mean? Like, who is it that I can see? Can I see a friend? Maybe if we keep social distancing, you know, but can we come over on my patio? Can we do something so that I'm in control and I don't feel like things are so chaotic? Because when we don't feel like we have control, that is not good for anybody, right? We strive off having some bit of control. So I would kind of echo that with David, and those things that are in your face and kind of making a lot of noise, get them to be quiet, and you have control over that.
You know, that's great advice from you and from David. Dr. Sosa, you mentioned earlier on, you said, you know, you really ask the parents how much social media is your kid on. Are you seeing the continued negative effects of continued exposure to social media when you're talking to families?
Oh, definitely. And kids have even more screen time now that they're in virtual classrooms. So it's really important that you disconnect. As David and Brady were both saying, you have control over turning off that device and really connecting with your families, or, you know, as a family. We know that family meals together, and it doesn't specifically have to be a family meal, but family time together, a sense of connectedness of the child with the caregivers, whether they be parents, grandparents, that is a protective factor that keeps them healthier in many, many different ways. And so really controlling that screen time and having that quality time together.
So along these lines, we've talked about how to help others. And then you talked about some tips too, David, but there are a few people. Here's one question. As a parent, I need to be the strong one for my family, but it is getting harder and harder to do that. So how should I teach my children to stay hopeful when I myself am having a harder time maintaining that hope?
Is that for David?
Yeah.
Okay.
Yeah. So I kind of cut off at the end.
Yeah.
But,
I mean,
just to make sure I heard the question right. It was as a parent, you know, trying to be stronger. That's your normal role of being strong and a center of power and stability for your family. But during these troubling times, how do you stay centered? And okay, is that it?
Yep.
Okay. Yeah. One of the biggest things. How do you take care of yourself? One of a starting point again is that, you know, your bookends. What are you doing how are you waking up and how you're sleeping? That's a great start. But one of the other things is, what are you doing for yourself? The body and mind are one. And when I say, what are you doing yourself? Are you drinking enough water? Are you taking a time out to at least get away or unplug from all this media, from all this news? Because we're consistently being bombarded with a lot of messages. It's not all positive, right? Look at that. Second thing is, go out for walks. I know the air's been bad, but walks or exercise are extremely important to help you reduce your stress and engaging in some level of fun. Now, your level of fun may have been going out to a lot of trips, and I know our society's been opening up now a little bit, but hey, maybe even board games, things that are different that you can do with your family and bring a sense of connectedness. Because one of the biggest things is, as a leader in your family and as your head of house, right? You're taking on a lot of things, and you're also responsible for your children. But taking a step back and making sure that you're taking care of yourself, making sure you're eating okay, watch your caffeine intake. I'm serious. Watch your caffeine intake. Get your water. Get your exercise. And then one of the things is too, if you find yourself overwhelmed, like, oh, this is happening, how am I doing it? Take a step back and take a 30,000-foot look at this. Like, when you're in the battle, you're in the mesh and you can't really gain some traction. But if you stop everything and kind of look away and look at it from down the hill, is what I say. It's like, okay, I can see what's happening here. I can see navigate a route out, and then take those steps. Goal setting is something that can be very well.
No, that's great. Brandy, here's one for you. What do you do if you notice a friend or family member struggling, but they don't want to talk about it, or they are closed off to any attempt to discuss the problem, but you know that they are hurting?
Yeah. So if they're closed off, I would say just keep prying, you know, kind of keep asking and bringing in, like, hey, I care about you. And I've noticed, and I call out specific behaviors that I've seen, not just like, you seem depressed. Hey, instead say, hey, I noticed that you haven't returned any of my texts, or hey, I noticed that you don't hang out with us anymore. You know, kind of naming those specific behaviors that you see instead of broad generalizations. Saying I care about you. I want to make sure that you're doing okay. I also ask a lot of open-ended questions. I think Dr. Sosa mentioned that as well for people and kiddos, especially. Last week I met with a kiddo and I said, how you doing? How are things? And he's like, I'm good, I'm fine. And then I said, you know what is hard for me is right now I feel like, and I just named a lot of things. I feel like it stinks that we can't go outside because of the weather or the air quality, and I can't stay inside because of COVID. I feel like this is never going to end. And then he just like just agreed with me on everything, but kept telling and sharing more and more of his own thoughts. And so a lot of times I just normalize it by saying like how I feel, and then kind of just hoping that they'll join in and kind of connect that way.
Good. Here's one for you, Dr. Sosa. A parent wrote in, my child's pediatrician completed a mental health evaluation for my child, recommending we begin now medication as part of his treatment. I am so afraid about the side effects of medications. What can I do to help my child during this process? And also, what can I do because I am very worried about it as well?
Right. So there are a couple of different approaches to treatment. And I'll say that in 2018, the American Academy of Pediatrics came out with some guidelines to help a general practitioner, so your family practitioner, your pediatrician, in diagnosing and managing depression in adolescents. And actually the guidelines came out for those as early as age 10 through 19. And so if your pediatrician or your practitioner diagnosed your child with mild depression, the recommendation is that you can start with about 6 to 8 weeks of close monitoring and some therapy. And usually therapy, when we're talking about therapy, it's going to be some sort of cognitive behavioral therapy, or CBT, and I'll touch on that in a minute. And then there's also some interpersonal therapy that we can do for adolescents. More often though, we use CBT. Again, I'll touch on both of those in a minute. The studies that they've done looked at medication alone, therapy alone, and medication in combination with therapy. And the best outcomes seem to be when there is medication and therapy initiated simultaneously, with the medication initiated early. But again, for mild depression, you can do a trial of therapy alone. So talking a little bit about cognitive behavioral therapy, or CBT, that's a type of therapy that's proven in the literature to work. And that really works on your thought processes, so your negative thoughts. So if you, let's say your child texts a friend and they don't hear back immediately, right? And then the thought process is, they don't like me, they hate me, they're mad at me. But maybe their friend is eating dinner and their parents make them put their device away for dinner. So there are a lot of automatic negative thoughts that come through. So CBT helps individuals really deal with those thoughts and how to interpret those thoughts. And then the interpersonal therapy helps with looking at interactions and relationships and how those affect your thoughts and feelings. So those are the two types of therapy. Typically it's CBT that's recommended. In terms of the medication in children and adolescents, SSRIs, or selective serotonin reuptake inhibitors, are the preferred first-line medication for your children to be placed on. Now, back when the studies were originally done, the FDA looked at 24 clinical trials that included over, I think it was close to 4,500 children and adolescents. And the thing that people worry about the most is this sort of black box warning that they think, or there's a perception that if you start on an SSRI, then there's an increased risk of completed suicide. But that is not the case. What they found is there is an increased risk of thought or ideation of suicide, but none completed suicides, okay, during the review of all the literature. So all that says is that you need to just be very vigilant if your child starts on medication, have frequent follow-ups once a week to initially start, and you can space those out with your clinician over time. I think that's the biggest fear that parents have about starting on medication, is that they're going to increase the likelihood that their child will complete a suicide, and that's not been proven in the literature.
But it sounds like you're saying that therapy has proven to be very successful, at least for the initial treatment of depression in children, and that it's always good to start there.
For mild depression.
For mild depression.
For mild depression. This is for your general practitioner, so a pediatrician or family practitioner. Once you get to moderate or severe depression, then the recommendation is that you also include a psychiatrist. So, and that would be a physician trained, right, to deal with more severe mental health issues.
Okay.
Prescribe. Yeah.
I'm not sure if you're able to answer this in a blanket way, but someone did have a follow-up to that question. How young is it safe to start a medication regime if that's the regimen, if that is the recommendation of the doctor?
Right. So most practitioners, primary care providers probably would feel comfortable, and again, this is just a very, very, very general statement, would probably feel comfortable to down to maybe 12. However, psychiatrists who specializes may feel comfortable much, much younger. I've spoken to some pediatric psychiatrists and they've started as early as 6 to 8 years. But it's really important if your child is that young that you do see a psychiatrist so that they can make a proper diagnosis. Because what we do know is that many mental or behavioral health issues in children evolve over time. And so a very young child may be diagnosed with ADHD, and later we realize it's actually not ADHD, but it's something else. So for younger children, I would go beyond and seek help of a psychiatrist if you're considering medication.
This next one is for David and Brandy. Lots of questions from people asking, so where can we find resources if we need behavioral health, mental health assistance?
Yeah, so I would say
start looking.
Yeah, right off the bat, I would say go to fresnocares.org. There's a great resource that's put together through Fresno County Department of Behavioral Health. And it's kind of like one-stop shopping. You can go there and get a lot of resources and recommendations for places in the county. I know that Valley Children's Hospital has one, right? As well, Valley Children's...
valleychildrens.org/mental health.
Yeah. So I know that those are two great places to look. NAMI obviously is a great place. David, I don't know if you have more you want to add.
Yeah, definitely visit, the ones already listed there. Just to plug the Lifeline number itself, the Suicide Prevention Lifeline is a great source, 1-800-273-TALK. It's there 24/7 free of charge. And we get a lot of third-party calls too when people are asking or, hey, I'm seeing this, what can I do or how can I help? So just use that as a resource. And if people, suicideispreventable.org is a big one as well, where it actually lists the different signs and gives you some certain scripts on how to kind of navigate that difficult discussion around suicide.
For those of you watching on Facebook, don't worry. We will put all of these resources in the comments so you can find them there. But again, fresnocares.org and then valleychildrens.org/mental health are two good resources. Someone just wrote in and said, are there any alternative medicines or tools that could also be explored before going down the medicine route? I don't know who that goes to.
I think that's...
Go ahead, David.
Well, depending on the diagnosis, I think that's going to be... Oh, wait. Can you hear me? It says...
Yep.
Okay, yeah, sorry. Depending on the diagnosis, of course, the pharmacology, is going to be left up to our pediatricians, our psychiatrists. As far as like behavioral therapists, such as Brandy, myself, clinicians in the field, there's a lot of different ways or interventions that we can do to help bring someone or improve someone's life. There's a lot of evidence-based practices out there that have been proven to work, and it just depends on what the individual is. With children, you want to go to someone that specializes in children, right? Then there's the way they're going to have play therapy, sand trays, different coloring, and it may seem like art or they're just playing, but no, these therapists are trained, they know exactly what they're doing, and they're experts in that. So what you may think is all they're doing is coloring all day or playing games. No, there's a lot of different behavioral cues and interactions and really get them to unpack and interact. So that's for the children piece. And as far as adults, adolescents, yeah, definitely go and talk to someone. When I say it is, it's like getting your car tuned up, right? So your car, you got so many miles on it, maybe you need to change the tires here, there, have a mechanic look at it. Hey, come in, check it out, and we can go ahead and see what's happening and give you some different alternatives. Definitely, like Dr. Sosa mentioned, if it is on the more severe side, that's when you're really going to take that pharmacological intervention, and you need to be seen by a professional there.
Brandy, did you want to add anything to that? David covered.
I'll add in that.
Oh yes, of course, Dr. Sosa.
Yeah, physical exercise, physical activity is a great therapy for anxiety and depression. So don't forget about that. I know David already mentioned that. And there are a lot of mindfulness techniques and tools that you can use for adults as well as for children. There are activities that only take a few minutes that you can do together as a parent, child, or as a caregiver and child when you're getting stressed or your child is stressed and they just need to sort of recenter and refocus and calm down. So definitely I would look also at some of those.
And speaking of exercise, I was looking at the forecast earlier. Temperatures are supposed to drop toward the end of this week, and the air quality is supposed to improve. That's been a huge barrier too. My kids and I were going bike rides after dinner before it got dark, and then all of a sudden, Creek Fire and all the other wildfires explode, and you can't even open your windows. And that has been particularly challenging, not only for kids, but for the grown-ups in the house too. But thank you for reminding us about that. There is one mom who wrote in, my 3rd grade daughter cries almost every day during virtual learning. She says she misses her friends. She hates distance learning. She keeps asking, when can I go back to school? What are some things I can do to help her cope? I'm hearing this a lot from even just my own friends whose children are really struggling with the distance learning environment, and just a lot of frustration and tears. I don't know if Brandy, you have any tips, or David on that one?
Yeah, I would say not trying to fix it, right? Sometimes as parents, we get we get concerned when our kids are having pain or hurt or just having a difficult time. And so we try to go in and fix it. Like, oh, it's not that bad. We'll be back before you know it. You can call your friend, all these things that try to fix it because we want to take away their pain. Really what we need to do is just get on their level, whether that's on the floor or eye level, and just validate, like, yeah, I'm so sorry. What do you miss most about your friends? What do you want to be happening in school? Like, just validating where they're at and giving them that opportunity to talk, and not discount or excuse away or fix, but just like, yeah, my kid the other day was saying, I just want to see my friends. Like, yeah, I want to see my friends too. What's the first thing you want to do with your friends once you get to see them? I want to play soccer. Okay, who usually plays with you? You like who, like just asking all those questions that allow them to know that they're heard, they're seen, they're validated, and that you too understand that you're kind of going through the same thing.
Mm-hmm. Yeah, it's funny you say that, because you do just want to fix it. And so I realize that when my own kids are complaining, like, virtual learning, or, being at the computer for 6 hours a day is terrible, and I miss my friends, I had to finally learn to say, yeah, it does kind of suck right now. Sorry for the language, but I mean, it's just because I can't fix it. And I remember we did a virtual health series a few months ago, Dr. Sosa, and I remember one day you were saying it's okay to acknowledge for these teenagers who missed their graduations back in the spring, or missed their proms or the other activities. Like, it's okay to say, you know what, this is sad. This isn't ideal. Instead of saying, oh, it's okay, just get over it. I mean, I remember you talking about that a bit, Dr. Sosa, before, that you have to acknowledge their grieving.
Yeah, and definitely where it's appropriate, share your feelings, just like Brandy was saying, right? I miss my friends too. I can't wait to get out and do this. Same thing if it's appropriate and someone in the family has suffered from depression, or if you've ever felt depressed, it's okay to share that with your child when it's appropriate. They'll know that they're not alone, and it helps to normalize it for them. And just keep checking in over and over and over again.
We did get this question in from Facebook just now. I've had to call law enforcement when someone I knew was threatening to take their own life. They ran away from home, but luckily they were found before anything happened. What can you do or say when you are in the midst of an intense situation like that? I felt very helpless to do anything, is what this person just wrote.
I heard part of the question. If someone called in, they called in law enforcement
Because someone they knew was saying that they were going to take their own life.
right?
Yeah.
And
So
so
what do you
they
do?
felt helpless about that.
Yes.
Yeah. Well, one of the things we first foremost, if someone's saying something such as, "Hey," if they're in the act, they have the means to do it. You want to activate emergency services as soon as possible to preserve that life, and it's totally normal to feel like overwhelmed or not knowing what to do. You're not trained in that. It's a very scary subject, and just acknowledging that fear that, hey, I don't know what to do right now. Call 911, right? And that's immediate. Same thing. So if they're not in the immediate act of it, or they're making statements such as, and they're not engaging in the act, I would call the lifeline itself. You call the lifeline. A third-party call can be made to reach out to them. But definitely learning the tools, like we mentioned earlier, about just starting that conversation. Because when someone's saying, "I want to die," right? "I want to take my own life." That's Edward Scheidman, the founder of suicidology, right? He's our guru, right? And he had mentioned that this is a psychache, right? And what a psychache is that someone's experiencing an amount of internal pain so great that they are willing to take their own life to end that pain. And they view that death as a way to end their life. So the order to preserve life is, okay, what if we could take away some of that pain? Would you now want to live? And that's why I kind of do with this, separating the ego into pieces and kind of taking that event or what they're internalizing and removing it. For the individual calling 911, good job. I know that's hard to do. One of the biggest fears is having the sirens show up, and I told my friend this, and now there's more shame and guilt and feelings about that. They did what they had to do without being trained. Anyone can save a life. That's one of the biggest things I say. It's just really starting to ask those questions in fear. But that's how they're viewing it. So it's tough. Sorry, I know.
No. And Brandy, are you finding that sometimes people are scared to get too involved? Like, am I overstepping by calling authorities, or is that my place to do that?
Right. The question that I get the most often when doing like a suicide prevention training is, what if I say the wrong thing? What if I do the wrong thing? I don't want to make it worse. Or what if they confided in me and I promised I would never tell anyone else? And now I'm kind of stuck because I don't want to break their trust, and I don't know, And so I always say, you don't want to promise, especially with teens and kids, you don't want to promise confidentiality with a friend, because you'd rather them still be alive and not be friends than to keep that secret. And now that they're no longer here. Right. So if a kid ever says to you, don't ever tell anyone this, but then you actually got to find an adult. You got to go tell an adult that this is happening. And then for those who say, I don't want to say the wrong thing, I don't want to make it worse, one thing you could say is that exact thing. I don't really know what to say, but I think I want to help you find the help that you need. And so let's make a phone call together. Like David mentioned earlier, there's a lot of third-party calls. So that's people calling on speakerphone saying, I don't know what to say, but my friend here is talking about suicide or wanting to end their life. I don't know what to say or do, but I hope that you guys can help him while I sit here just with them, So I would definitely suggest that.
No, thank you. David, I know that there were a few questions in Spanish that came in. I believe that you had one that, because we are planning the same topic for our Spanish speaking audience. So that's going to happen in the next few weeks, but we have been getting a few questions in Spanish. Did you want to answer one real quick, David? I think that it went to you directly.
Y sí, so la pregunta era si podemos ayudar que se lo pasen con depresión, tenía pensamientos de suicidio. So, cuando la gente tiene depresión, va a tener más pensamientos de suicidio. Esa es parte de depresión. Que ustedes lo pueden hacer, primero es practicar con sus hijos. Es muy importante que gasta tiempo con ellos y ver cómo andan durante el día y qué estás haciendo durante el día. Por ejemplo, de su hijo está durmiendo más, o está más enojado, agresivo. Esas son cosas que puede ser otros, se puede ver diferente, y ustedes pueden pensar que, ese no es, mi hijo está tratando mal o no está escuchando, pero si ustedes ven eso, es muy importante que en la práctica con ellos, a ver qué está pasando con la presión, pero en pregunta directamente de suicidio, de ellos está teniendo pensamientos de suicidio, y luego si está diciendo que sí, agarra ayuda por ellos, por ejemplo, agarra la llamada 1-800-279-8255.
Thank you so much. Thank you for addressing that. And we wanted to make sure for those who speak Spanish that we let them know that there's another segment we will be doing. So we're coming up on time. Here I am thinking, I wonder if we'll get enough questions to fill half an hour. Now we're going at an hour. So obviously what Fresno County has seen in the last month, you all have seen, whether that's in the medical clinic setting, Dr. Sosa, or whether it's in your practices, David and Brandy. I do want to say thank you very much to the three of you for tackling this very, very sensitive but so important topic. And we do want to put on the screen right now a list of resources that the three of you did mention earlier. For more information about resources, you can visit valleychildrens.org/mental health. There's a good variety of resources there for different parts of the Central Valley as well, for all the counties Valley Children serves. And then FresnoCares.org, that is through the Fresno County Department of Behavioral Health. That is a fantastic site that not only lists resources if you need help, but also things like what are signs of depression? What are some things you can do, some things that Brandy and David were talking about as well. FresnoCares.org is a great resource for families. And then also the Suicide Prevention Lifeline, 1-800-273-TALK. That's 1-800-273-8255. David, I believe that's 24/7, correct?
Yeah, it's 24/7.
Okay. And then there is also the Fresno County Access Line at 1-800-654-3937. You can also text at 741-741. David or Brandy, what is this resource specifically, the Fresno County Access Line?
The Fresno County Access Line is a way for individuals to call in and get directed towards who's there, what services are provided their county. So it's a great starting point to figure out what resources are here in the Valley. And then they could direct it through there. Yeah.
Okay, great. Thank you. Again, thank you to Brandy Lidbeck, David Lopez, Dr. Carmela Sosa. For those of you who still have questions, go ahead and continue to post those in the Facebook comments and we'll get the answers for you later on that. We will also post this on all our other social media channels so that if you want to share this with friends or family who want to watch it later, you can do so then. Again, Brandy, David, Dr. Sosa, thank you. Thank you. As a parent, as a stressed out parent who's dealing with some of these issues myself, it's greatly appreciated. And thank you again for reminding people it's okay to talk about it. We have to talk about it. So thank you again. And to those of you watching, thank you as well. Stay safe. You can open your windows probably in about 3 days. And again, continue to reach out for resources if you need them.
Thank you all for this time and opportunity. And remember, we can all live a good life and take care of each other. We need to be kind humans.
Love it. Thank you. All right. Bye-bye.